Thank you for joining us today. Today, we're joined by Santokh Gill, the CEO at LifeCenter Northwest. Santokh, welcome, and we appreciate you joining us today.
Yeah, I'm very happy to be here. And Steve, thank you so much for hosting this series.
You're welcome. There's so many new leaders like yourself, and we think this is a great opportunity for your OPO colleagues to get to know you. As you're aware, we haven't been able to do a lot of in-person meetings, so this is just another forum for that to happen. You've been a CEO now for a little over 6 months. You began March 1st. So what is your favorite thing about your career in organ donation?
Well, I want to first just start by congratulating all my colleagues and the OPO community for this huge milestone on Friday where there were 1 million organ transplants. And, as I've gotten to learn a little bit more about donation and transplantation, we know the number that's impacted is far more than that. It's a multiple of that, and maybe it's 3 to 5 million. If you think about all the concentric circles around people that receive organs, their family members, and how impactful that is. So congratulations. Despite being in healthcare for 25 years and running a kidney and pancreas transplant program, I don't think I had really a full appreciation for the complexity of donation. Organs showed up at our doorstep at the transplant center, and we went to the OR and we did the transplant surgery. And then we were worried about, just the recovery of the recipient and the family. I had no idea that fewer than 1% of all deaths are even eligible for donation, or that it's often tragedy that leads to donation. And so I've just really come to appreciate all of that. And then when I think about the value stream, starting at the referral for donation, to honoring the donor family and donor decisions, to donor management, to the recovery, and then finding a home for that organ or those organs, and then the transplantation. I know now that there's, hundreds of people involved in that process, and they're mission oriented, they're dedicated, they're extremely talented. There's precision required at so many steps in that process, and there's good fortune that's required. And so when we say it's a rare and remarkable process to have donation happen, I really have come to fully understand, what that means. And so my favorite part about being part of this community is I am so looking forward to making 50,000 of these life-saving events occur within the near term here.
Yeah, no, and we appreciate your commitment to that goal, and we're looking forward to hitting that. And you're right, it's amazing we got to 1 million, but there's we've got a lot more to go. And thanks to efforts by you and others, I think we're going to get there by 2026. How would you describe your leadership style? You talked about coming over from the transplant center and sort of that perspective. So how do you describe your leadership style coming in?
Yeah, I think my background has really been in large health systems and hospital systems, but I would describe my leadership style kind of 3 things: engaging, strategic, and situational. In terms of engaging, I really do want to engage in the work. I think it's really important for me to understand what we do and know how we do it and the people who do that work. And more importantly, today than ever before, it's critical for me and all of our leaders to, when we connect with team members, to make sure that they understand how their work connects to our strategic goals and our mission, that, that they are important for who they are, and their work is really valued, that they're recognized for the work that they do. So from an engaging perspective, I think that's been a really important part of my leadership style. From a strategic perspective, I've been put in many different situations where I didn't have full knowledge of the work that I was being asked to do. And, I've just found my way around that. I study a lot. I can digest a lot of information. I talk to people who are doing the work. And so, as a leadership team, we are really deliberate and decisive about what we want to do, what we choose to do, and what we choose not to do in service of our mission. So I think strategy and strategic thinking about that has been really important. I have a low bar for over processing. And so, I do think it takes more effort to simplify things. And that's kind of the space that I like to live in. And I think the strategic funnel really helps you distill down, what are the essential things that you need to be doing. And then situational, I can flex my leadership capabilities up and down. And so it really depends on the conditions, both in the organization and in the marketplace, but also how we're performing as an organization. And so I don't mind flexing that based on the situations that we're dealing with.
That's a great understanding of your leadership style, and that the situational one really interested me. And so when we get together, I'd like to explore that more with you, sort of offline.
Yeah, happy to do so.
Yeah. What motivates you to work hard?
I think like so many people who have chosen a healthcare career and are in healthcare, we were born to be in the arena. And over time, you're built to be in the arena. And certainly, I feel like that's where I belong. And when I fall, I don't stay down for long, but I really do want to be in the arena. I want to be there where we're making things happen. And part of that is having meaning and purpose in our work. And that's a wonderful motivator for me. The greatest return I've had for the education and work experiences that I've had is I've actually had an opportunity to choose professional roles that have that kind of meaning and purpose to it. And I can really think back to the last 20 years of my career and been very fortunate that that has been afforded to me and that I've earned that. I think the other big motivator for me is really leading and working alongside people who are smart, capable, that they're humble, and that they take great pride in the quality of their work and their work product. That is such a motivator for me. And I really enjoy that. I think, leadership is an honor and a privilege. Some 15 years ago, I got my first clinic management job, and I felt that way even at that time. And so I wake up every day feeling like, I need to earn my position. And so that's a lot of how I go about doing my day-to-day business.
Yeah. That's great description. And that's, I really like the connection to purpose. And you're right, but for those of us who've been in healthcare, it's the other end, it's the patient end, it's seeing the patient, seeing the system improve, seeing people improve. So what, and speaking of purpose, so what interests you the most about where LifeCenter Northwest is heading in the future?
Yeah. I'm extremely excited to be here. We have an incredible leadership team from our managers, directors, and senior leadership team. We have a strong foundation that's been built over many years here. So we have an opportunity to really excel. The senior leadership team, we have a very healthy relationship. I'm really excited to work with our senior leaders. They're a wonderful group of 3 people and myself. There's a lot of give and take in discussions. It's a very healthy relationship, and we enjoy working with each other. So that's been really, really important to me. When I think about LifeCenter Northwest, every organization has a life cycle. And where we are as LifeCenter is we need to retool, re-engineer, and rethink some parts of our organization. And that's absolutely necessary to make it forward compatible and more successful. There were things that got us to here, and we've had a very successful track record. And then now there are things that we need to think about doing differently. So just some of the things that we're contemplating, I would say, we're really looking at surgical recovery model and how do we bolster that? How do we improve our ability to honor donor timeliness issues? And how do we cover our geography? We cover Alaska, Montana, Idaho, and Washington. So that's a big territory. So we've already made significant strides in our surgical recovery model. Workforce planning is a really important issue for us. We've developed horizontal career pathways. So our team members have an opportunity to grow within the organization. We also have vertical career ladders so that within a particular role, they can continue to grow. But we need to go much further upstream and really do proactive workforce planning about what our needs are going to be for the future, given our track record. And Seattle's a very competitive market, as you know. It's very competitive for workforce, but also a very expensive city to live in. So that's one area that we're working on. We're excited about potential models for donor care units. I think if we had a donor care unit or a recovery center in Washington State, that was the crown jewel of our corporate headquarters, that would be very meaningful to our team. And personally, that would be very meaningful to me to develop something like that. We're looking at preservation techniques and technologies, as well as recovery techniques, so that we can have healthier organs when we recover them, and so that they can travel further, so that they can get to people who are in need. And that's really important for our geography. So we'll be evaluating those things as well. I'm excited that we're developing a curriculum based on the Toyota production system. We have our first class next week. We're doing an education day for some of our leaders so that they'll be trained in lean and continuous improvement. And then finally, our DEI work. It's something that I'm extremely proud of this team that started this work far before I got here. And this is not a time-bound initiative. This is how do we build this into our organizational practice and make this a permanent part of the fabric of how we run our organization. And Steve, I've been in healthcare for 20 years. We've done race, age, sex discrimination. We've done bias training. We've done, now we're doing, privilege and all kinds of things. And just like society, those things have not taken hold. They have not taken effect. And I feel more confident today about the effort that LifeCenter is doing than I ever have in any one of those occasions in my past. And it was always with good intent. It was well resourced, but it just didn't have the sticking power. So these things are not new to my OPO colleagues. They've all done this work, but it's new for LifeCenter. And so that's why it's so exciting for us. And so our senior leadership team and I will really work on figuring out a game plan around those things. And I'm excited about that.
It sounds like a lot of initiatives in the works and a lot of things going on as you come in, and look forward to seeing where it goes. And you're right, you have a huge territory to cover, huge geography. So some unique challenges that you have to overcome, but be interesting to see where this all leads, and really interested in the DEI initiative. And as you know, we've undertaken it, and you've got to keep on it. It's something that's not a one and done. It's got to be ingrained into the culture of the organization. And so excited to see where yours leads as well.
Yeah, and I know that AOPO is doing a lot of work around this, and I hope for all of us that it does have a lasting impact. And I think certainly the inertia and the energy and the commitment is there from so many of my colleagues, as well as your organization, Steve.
Yeah. So a lot of things you're juggling there, and a lot of things in the future. What's your proudest accomplishment?
Yeah, I think these fall into kind of three categories for me. The first is, I have 3 school-age biracial kids. They're wonderful. They're kind. They're selfless. They're loving. And so I'm really proud of them, and they're happy. And to say that after the last 3 years, that's a big deal. It means something different today than maybe 3 or 4 years ago. And so I'm really proud of them. And but let's not be confused, Steve. I'm not the one who's up at night with them when they're vomiting, or signing them up for soccer practice, or chasing after them around completing their homework. So we were very proud of our family. I'm really proud of our board. Yeah, they were broad thinking in the CEO search. And, for me to have 25 years of healthcare experience, and many times organizations have leaned on me and given me the opportunity to take on assignments, and often I've said yes. And now I am in a role where I can draw on all of those experiences and really help LifeCenter Northwest, help our team, and move forward on our mission. It's a very exciting place to be, and to be in this role where you're able to do that. So I'm really proud of that. And then, I could go on about accomplishments just like most people who have had a long career, and where, I've strengthened the core business. I've, grown out programs and business opportunities. We've brought on new life-saving technologies. We've transformed our organization from a 1 hospital to 2 hospital system. But, it's interesting, as I thought about this question and I reflect back, all of those things have a certain shelf life. Some of those have been undone. And so those aren't the things I particularly remember. What I particularly remember is the people that I've helped along the way, and when I took on my first clinic manager job, I had 3 African-American receptionists, and they were so good at their job. And boy, I just was like, oh, this is not where this is going to end, for them. And so one of them became a lead medical assistant, one became a supervisor at the clinic, and the other person became a manager at our main campus for a much larger revenue cycle unit. And so, throughout my career, I've tried to help others, whether it's a disenfranchised physician group, helping them get re-engaged in the work that we're doing, whether it's leaders who are looking for that next big opportunity, helping support them. And certainly I've had that help throughout my career. And, I remember each one of the people who helped me, and I'll never forget it. And I think that's been true as well for the people that I've worked with. And then I think even in all of the transactions that we've done, it's just being respectful, and how do you want to be remembered as a leader when you're interacting with others, whether they're competitors, whether they're new partners, how do you want to show up, and how do you want to, be remembered by those folks that you interact with? So that's the thing that I focus on a lot.
As you know, as a leader, you're defined by those that you pass on and that you develop. And it sounds like that's a huge focus of your career and of what you've focused on, besides your family and developing them as well in the organization. So I think that's great. Any final thoughts as we wrap up for your colleagues who are watching?
Yeah, I would just say I've had so many colleagues from organ, tissue, eye donation, kind of reach out to me, and, they're very open and transparent with sharing information. And, I so appreciate that. So I just want to say thank you to all of them, and taking that first step, by reaching out to me. I think the work, Steve, that you and Barry are doing is really important. I think it is important to keep a community of OPOs together that are learning together. And, in the hospital business, here in Seattle, we compete for tertiary quaternary care. We have academic centers, we have large medical centers, we had our hospital, and, we would compete for service lines and tertiary quaternary care. But, when it came to policy and payment at the state or national level, you would never know that that was the case. And when it came to community, community issue about access to healthcare, or, certain hospitals were having a surge when others had capacity, we would find a way to work together. And so that's the model that I'm accustomed to. And I think that's what you and Barry are working towards, even strengthening further. And I know historically that's always been here with AOPO. So I'm excited about that, and I want to contribute to the pool of knowledge and information and share that with my colleagues too. So at some point I'll get there.
Well, no, we appreciate it, because obviously you've got a lot of things that you're juggling. And we really want to hear sort of, the process you went through and the progress you've made. So I think we look forward to having you present at one of the upcoming meetings or on a webinar. So I think that'd be great to hear.
Well, I want to make sure it's value added, Steve. So thank you for the invitation. So I'll work on that part.
So I appreciate you taking time to spend time with us today. It's been a great conversation, and I look forward to seeing you in person later this year, hopefully. And again, thank you for your time.
Absolutely. Thank you for your time, Steve. And I too look forward to seeing you again. So thank you very much.
All right. Thanks.
Bye-bye.
Bye.